Obstetrics and gynecology have two parts. Obstetrics and gynecology. Obstetrics is the medical and surgical care of pregnant women, whereas gynecology is the care of the female reproductive tract. O&G is a kind of primary care with a strong emphasis on long-term care. After all, you'll be seeing your patients from puberty to adulthood, during pregnancy, and then through menopause and beyond. Actually, it is the ideal blend of general care and surgery. The only thing you give up are the prostate and male reproductive organs. In obstetrics, the bread and butter includes delivering infants by vaginal birth or cesarean delivery, generally known as C-section. Pregnant women should be seen once a month in the first trimester, every 2 to 4 weeks in the second trimester, and every 1 to 2 weeks in the third trimester. You'll be checking on the mother and fetus and searching for any abnormalities or symptoms. The unique aspect of this period is that women are quite involved in their medical treatment. Many people are reluctant to attend their primary care physician, but once pregnant, they frequently reprioritize their own and their baby's health. In gynecology, you'll do the yearly well woman check-in clinic, as well as treat pelvic discomfort, infections such as vaginitis or STIs, and offer contraceptive alternatives. If you're on call, you'll hurry to the emergency room to treat ectopic pregnancy, ovarian torsion, and vaginal bleeding from a variety of causes. In the operating room, the most frequent procedure is a hysterectomy, which involves the removal of the uterus. If there is bleeding, the patient may exsanguinate, which means he or she may lose a significant amount of blood. A tubal ligation is also an option for people who want to eliminate the potential of future pregnancies. Consider this the feminine equivalent of a vasectomy. There are several methods to classify the specialization. To begin, you can categorize the specialty as having an obstetrics emphasis, a gynecology focus, or being a generalist who deals with both. You'll be a generalist right out of training, capable of handling both obstetrics and gynecology. Some people continue along this route because they don't want to give up either component of the practice, while others focus on one. As a generalist, you will be on call for both labor and delivery and gynecological emergency department, frequently at the same time. Those who desire to concentrate on pregnancy and childbirth will limit their practice to only obstetrics. Obstetrics is separated into two sections, office and labor and delivery. Regular checks with pregnant women will be the focus of office visits during all 3 trimesters of pregnancy. When a lady is in labor and delivery, you assist in the delivery of the baby. As an obstetrician, you can operate as a solo practitioner, which is becoming increasingly rare in modern times, or in a group practice. Babies are not concerned with your 9-to-5 work schedule and are born at various hours of the day, resulting in a more demanding schedule and lifestyle. Obstetrics pays the least compared to becoming a generalist or a dedicated gynecologist. The reason for this is that insurance companies and Medicare fund pregnancy as a single bundled payment that includes all office visits as well as labor and delivery. Those who desire to focus solely on women's reproductive health will practice gynecology. As practitioners develop in their professions, the likelihood of getting summoned in the middle of the night decreases. When you're 50, you're probably not as keen to go to the hospital in the middle of the night. This is the more profitable option than being a generalist or obstetrician since there are more procedures. Consider the lifestyle to be comparable to that of a urologist, where you can spend more or less time in the operating room based on your chosen balance and can move to a more clinic-focused practice in later years. O&G is also classified by practice environment, with academic, community, and private practice options. In academia, you'll be educating medical students and residents, as well as undertaking research on top of your clinical responsibilities. In comparison to other sorts of practice, this often pays less. However, because these are tertiary care clinics with state-of-the-art technology, extensive resources, and specialists in other specialties for consultations if required, you'll be more likely to witness more challenging and frequently intriguing situations in academia. Academic facilities, which can treat preemies or newborns with congenital problems, are also ideally suited to handle severely premature births. In general, community institutions and private practice groups are under-equipped. It's important to remember that delivering infants isn't only about ensuring the safety of the mother, it's also about ensuring the safety of the baby. You'll work at a medical group that isn't linked with a teaching hospital in a community-oriented practice. This is the most popular sort of practice, and it caters to the vast majority of people. A private practice group may be associated with an academic facility or a community hospital. Physicians in private practice own a portion of their practice, and the more effort they put in, the more money they receive. While private practice ONGs earn more than university or community-based ONGs, they are under more pressure to see more patients, book more cases, accept more calls, and work more overall. The more frequently you must accept calls, the smaller your practice. Whereas academic institutions accept all patients, even those without insurance, private practice groups may only accept patients who have insurance and whose medical presentation is less difficult. Following medical school, an obstetrics and gynecology residency lasts 4 years. You can choose between categorized and advanced pathways. With categorical, you complete all 4 years at the same institution. With advanced programs, you'll initially spend a year as an intern at one institution. This might be a preliminary or transitional year, following which you will finish your 3 years of obstetrics and gynecology residency at a separate institution. After finishing your obstetrics and gynecology residency, you might choose to further specialize with a fellowship. Maternal fetal medicine, or MFM, is the only obstetrics-specific fellowship that lasts 3 years. There is a high level of ultrasonography, labor and delivery, and some neonatal surgery may be performed. You'll mostly be dealing with more difficult pregnancy problems, such as cardiovascular concerns, diabetes in pregnancy, or a patient with mechanical heart valves who needs anticoagulants fine-tuned. You'll also assist in the coordination of treatment for fetuses that are unwell or have unusual illnesses. This fellowship is for ONG geeks who want to sit down and read 3 papers in order to make one choice hours later. Gynecologic oncology also lasts 3 years. There is usually 1 year of research followed by 2 years of surgical training. Nothing frightens these cowboys and cowgirls of surgery. Even if it isn't cancer. Gynecologic oncologist can assist rescue the day if something goes wrong with the female reproductive system in the hospital. Gynecologic oncology surgeons are unique in that they administer their own chemotherapy, which means they are responsible for both the medical and surgical parts of oncology. In most other fields of medicine, medical and surgical oncologists work separately. The most prevalent malignancies they treat include uterine, ovarian, cervical, and occasionally breast cancer, which is managed by general surgeons who have completed a breast fellowship. Urogynecology is a 3-year fellowship that overlaps with urology. Both, for example, do several cystoscopies and bladder operations. As a urogynecologist, you'll largely deal with incontinence, the inability to regulate urine, and prolapse, the bulging or dropping of some body parts into others. There are different sling and mesh methods for dealing with continence, as well as procedures for attaching a prolapsing bladder, uterus, or rectum. This is for individuals who don't mind passing a lot of pee and for the elderly. Reproductive endocrinology and infertility, or REL, is a 3-year fellowship that focuses on infertility. This includes in vitro fertilization, egg transfers, polycystic ovarian syndrome, and hormonal concerns such as premature puberty, often known as early puberty. You'll be collecting eggs, freezing and defrosting them, injecting sperm, and fulfilling desires. Obstetrics and gynecology is also unusual in that it provides both primary care and advocacy. There is a major emphasis on public health, particularly women's health advocacy, and while this is widespread in primary care specializations, it is less typical in other surgical subspecialties. If you're interested in infertility, abortion, contraception, or becoming a part of social and political change in women's health, obstetrics and gynecology is the field for you. Finally, there is the patient population. You'll be interacting with many young or middle-aged patients in obstetrics, offering you the chance for meaningful and high-impact intervention as they present for prenatal care. In comparison to many other non-pediatric specializations, your patients will be younger on average. Thank you so much for tuning in. If you liked this video, please subscribe to the channel and turn on your notification bell to keep up with the series.